I think one of them is the problem of socioeconomic gradients in disease. And from a perspective of primary prevention, the increasing prevalence in many parts of the world still of smoking, of hypertension, and of diabetes and obesity, metabolic syndrome, lack of exercise. All of these factors, which are in fact becoming more common in some areas, are going to lead to more cardiovascular disease in future, particularly as the population ages. And I think it's a real challenge for us to keep that perspective and to try to influence the pattern of disease worldwide. We're actually very effective already in many of the technical things we can do, but this is a social challenge that we haven't addressed well.
Prevention.
It's still primary prevention, still very relevant. We're not preventing disease, we're postponing it, but we want to keep people healthy for as long as possible. I think we're slow in medicine to tap the resources of information and computing technologies. We have the problem of huge amounts of information that we can't cope with, and we have yet, I think, effectively to use clinical decision aids, diagnostic support systems, and systems that would help us to manage patients effectively, not to replace clinical judgment, but to give us tools that will prevent us from making errors and improve our skills as thinkers.